It's definitely winter viral season, and we're seeing way more infants in the office with bronchiolitis, some of it due to RSV, and that is only going to increase. What I think most parents don't know the difference between how infant RSV bronchiolitis differs from typical wheezing, especially in older toddlers, preschoolers, and older kids, and why the treatment can look very different. And because there's a very fundamental difference in the airway that's involved in the airway anatomy. So let's get into it. In bronchiolitis, we're not dealing with the large and medium-sized airways, which are normally the airways affected by typical wheezing, either viral-induced wheezing or asthma, where you're dealing with the bronchiole, which is the smallest airway before the air sac. The bronchiole is different because it doesn't have smooth muscle, so it doesn't necessarily constrict until kids are older. Kids under 6 months have almost no significant smooth muscle in the bronchiole. So what happens in bronchiolitis is that bronchiole simply gets inflamed, swollen, and filled with mucus and inflammatory debris, and that's what obstructs the airflow into the bronchiole and causes the symptoms we see as in bronchiolitis, which increase work of breathing, low oxygen. So when young infants present with bronchiolitis, there's often very little to do. Many doctors, emergency departments, pediatricians will do a trial of bronchodilators, something like albuterol, to see if they may be bronchodilator responsive in case there is some smooth muscle constriction. But in RSV in infants, especially under 6 months, that rarely helps. So we're really dealing just with suction to clear the mucus out of the upper airway to ease breathing, oxygen and hydration, and simply observation and waiting for it to get worse or get better. If they get worse, they get higher respiratory supports, things like high flow nasal oxygen, or sometimes even mechanical ventilation if they have complete respiratory failure. And then waiting for time to get better on its own. This looks very different from when older infants, preschoolers, and toddlers present with wheezing that are usually treatable with bronchodilators and medications and steroids, very few of which of those work in infants with RSV. So be aware of what the signs and symptoms are. Please check my other post looking for the main sign concerning respiratory symptoms, which is retractions. I have a big video on that. And please put any of your questions in the comment section.